Assalamu alaikum. On behalf of Ahsan Academy, let me welcome you to a presentation on the sternum. Let us fix the objective first. We'll try to find out the position of the sternum in the anterior thoracic wall and in the thoracic case. Then we'll discuss in detail the features of the sternum, and every stage we will try to correlate the clinical aspects. The three photographs are there. The medial one is the thoracic case, and the upper two are actually thoracic wall, showing some features on the left side. So the uppermost part is the jugular nose, and this is the upper limit of the sternum, which is forming the anterior part of the thoracic case. This part is the manubrium sterni, and on the right side is the body of the sternum. So this is forming a flat anterior part of the thoracic wall. The ribs are attached to the side of the sternum, and this part indicated by the arrow is a bit elevated, which is known as sternal angle. This sternal angle is especially important for the physicians to as a landmark, so that they can identify different parts of the thoracic wall. Like this part, see on the lateral side, the second rib with the costal cartilage remains articulated. So with the help of this, we can count the rib and can identify the position of the different structure within the thorax or below. This is the sternum, and sternum is a flat bone, and it is obliquely placed in the body. You can see in the figure the upper part is more oblique than the lower part. You can see the sternum on the right side, and it comprises of three parts: the manubrium sterni, body, and the xiphoid process from above downward. The manubrium sterni is almost triangular and has anterior surface, posterior surfaces which are transverse. Anterior surface is transversely convex and the vertically concave, but posterior surface is relatively smooth and it is concave from all directions. This upper border having three notches. The median one is known as jugular notch or suprasternal notch, and either side the clavicular notch. The clavicular notches are for the articulation with the medial end of the clavicle. On the lateral side, there are a series of facets. It accepts the medial end of the costal cartilage of 1st to 7th ribs. The body has anterior and posterior surface, and it comprises of 4 pieces. The pieces are fused on puberty, and the ridges can be visible on the anterior surface only. The posterior surface is relatively smooth and concave. This is the manubrium sterni on the right side. If we draw a horizontal line, the upper border cuts behind the intervertebral disc between the thoracic second and third vertebral body, and the lower limit lies between the intervertebral disc between the thoracic fourth and fifth body. So this manubrium sterni lies at the level of third and fourth thoracic vertebra. This is forming the, this is the mediastinum shown. So the superior mediastinum anteriorly bounded by this manubrium sterni, and the joint between the manubrium sterni and the body remains at the level of the intervertebral disc between the fourth and fifth thoracic vertebra. So the body remains at the level of thoracic 5 to thoracic 9 vertebra. This is the body you can see in the thoracic case, and it lies at the level of thoracic 5 to 9 vertebral bodies. So this is forming the anterior wall of the inferior mediastina. The costal cartilages attached to the lowermost costal cartilage that attached to the body of the sternum is the 7th costal cartilage, and subsequent cartilages up to the 10th makes the costal margin, a series of articulations. This is the junction between the manubrium and the body of the sternum. It is elevated anteriorly and known as sternal angle. The joint between the body and the xiphoid process is xiphi-sternal joint. This costal cartilage remains attached to the lateral margin. This one is the first facet for the first costal cartilage, and the second one lies at the junction between the manubrium and the body, manubrium sternal joint at the sternal angle. Subsequently, the third, fourth, fifth, up to the 7th costal cartilage remains attached to the lateral border of the manubrium of the sternum, and this last one actually articulates with at the joint between the body and the xiphoid process, xiphi-sternal joint. With the help of the sternum, we can identify different areas on the thoracic wall and can identify different important points. So sternal angle is an important area for the surface marking. You see, with that we can count the ribs and can identify the different position. Like I have shown here, this is the 5th intercostal space, and just medial to the mid-clavicular line, this point is showing the apex of the heart. Attachment are shown in the figure. This is pectoralis muscle and remain attached to the red mark areas covering the manubrium sterni body. And above you see the attachment of the sternocleidomastoid is shown. The white arrow on the right figure is showing the muscle. It is attached to the anterior surface of the manubrium sterni in the upper part. On the posterior surface, there are several muscular attachments. This is a small area, rounded area. This is the sternohyoid and the lower part sternothyroid muscle. You can see this sternohyoid and sternothyroid muscle in the right figure. The lower part, the body on the either side gives area for the attachment of the transversus thoracis. This is the muscle. Important relations between the behind the manubrium sterni is clinically very significant. You can see on the right side the thorax, the heart is there, and great vessels are running, are attached actually to the upper part. And these great vessels with the trachea and its bifurcation, root of the lung, are shown on the left figure. I'm drawing manubrium sterni in front of there, and you can see as a shape the structure behind the manubrium sterni. These lines are marking the arch of the heart, arch of the aorta, and this is brachiocephalic vein on the left side. So left brachiocephalic vein. Just above the left brachiocephalic vein, the upper part of the manubrium sterni is safer in relation to important structures. So if we draw it on the surface, you can see this is the position, and so this is the area for the arch of the aorta, and below the line this is the area for the left brachiocephalic vein, and behind that 3 branches of the arch of the aorta lies. So these areas are relatively danger, because if the needles are placed in this manubrium sterni to take some specimen of the bone marrow, in that case this vena cava and this arch of the aorta and brachiocephalic vein are related to these areas. Relatively, the upper part is safe. So this area is chosen for the sternal puncture. With the help of that, we can collect bone marrow from here, that is the red bone marrow, to investigate it to identify some disease. Let me show actually the relations. For that we need the articulations. This is the position for the costal cartilage 4, then 5, 6 and 7 are attached. You see, if we want to draw the lung anterior border or pleural anterior border to a reflection actually lung, let us show the line. This is the point, first point, the midpoint of the sternoclavicular joint. This is another point on the right and left side. Then one point in the sternal angle, very close. For the lung, it should be a bit apart. This is showing the pleural reflection. So let us go down. It is a fourth costal cartilage level, close to the midline, 2 points, and then the deviation occurs. On the right side, it goes down straight up to the xiphisternal joint, but on the left side, it deviates. This is on the 6th costal cartilage. So now drawing line and drawing this. So this notch is known as cardiac notch, and this area over the sternum is known as area of superficial cardiac glidance. Actually, this notch is related to the pericardium, that is the covering of the heart, and behind that lies heart. So whenever we tap with the finger, this area, because of the blood, taps dull, but lung contains air, that's why tapping shows resonance. Ossification for this bone is clinically important. Actually, 2 plates of cartilages are formed, and this moves towards the midline, and by fusion produces a cartilaginous model of the sternum. This you can see, and darker area actually shows the point of start of ossification. This is known as ossification center. So for the manubrium, there are 1, 2, 3 centers and appears at the age of 5th fetal month. Then if we consider the upper 2 pieces of the sternal body, each has 1 or maybe more than 1, and usually appear with that the upper one means centers of the manubrium sterni. Below, the centers are usually in pairs for each of the piece of the sternal body. Then this appears a bit 1 month late. Xiphoid process remains cartilaginous at birth, and usually around 3rd years of life or later, ossification starts. You see, remains species at birth, but this fusion begins at puberty and continues from below upward, and at the age of 25, all the joints fuses and sternum become a single bone. Sometimes fusion between the 2 plates fails and remains soft tissue, usually in the body in the midline. This remains in the form, and bone cannot be found in this area. So this soft area may be found in some sternum. This is an anomaly, and this is known as sternal foramen. So whenever we target the body of the sternum to collect the bone marrow, this should be kept in mind. So the significance is we can collect bone marrow, red bone marrow, from the sternum, and it is selected because this bone is superficial and easily can be penetrated to get the bone marrow from it, and normally red bone marrow remain in this middle part throughout the life. Thank you very much for remaining with the presentation.